Good morning, everybody. This is Dr. Lisa Finkelstein, and welcome to Beyond Telehealth and Telemedicine is Medicine. We have a special guest today, Brittany, who's going to introduce herself in a minute. The reason why I wanted to talk with Brittany is that she just finished her residency in the middle of a pandemic. And this is a really quite an interesting story. So, Brittany, introduce yourself and tell us where you just graduated from, where you are now, what's your specialty, what EHR you use, and what telemedicine platform you use.
All right. Well, first, thanks for having me, Lisa. I'm Brittany Williams-Opare. I graduated from Philadelphia College of Osteopathic Medicine and entered my family medicine residency at Penn State Health St. Joseph's here in Reading, Pennsylvania. Just finished back in August of this year. Not class of 2020, we're class of COVID-19. Currently a family medicine attending with Lehigh Valley Health Network, and we are using Epic as our EHR. And as a part of that, we're using Haiku, which is our video portion for the telemedicine when it comes to Epic.
So this is a big healthcare system, but let's go back to your residency. Tell us the story. It's March 2020, the pandemic starts, and what starts to go through your mind as this is my last year graduating? Yeah. I'm graduating.
So even before the pandemic hit, the last 6 months of residency is usually very, it's scary to begin with because there's a certain number of encounters that we have to meet in order to graduate and be eligible for graduation from residency. So it's already known that, those last 4 to 6 months, you're going to be spending more time in the clinic anyway to try and make sure you meet and surpass those numbers. So with that already in our minds, as soon as the pandemic hit, and it's like everything kind of shut down, especially that first week, we didn't know how we were going to meet our numbers. We're panicking, are we going to be here until December trying to finish residency? But thankfully, telemedicine came to the forefront. We weren't using it at all in our residency program. So they were able to figure all of that out, and we were, going through the telephone. We were using videos to really, get our numbers, meet the encounters. The patients really appreciated it because they felt we were keeping them safe by not having to bring them into the office. So all of us were able to graduate on time, which we were thankful for, and our patients were thankful as well.
Yeah, so the champions of telemedicine all knew all this beforehand, and we really realized that telemedicine in this pandemic was a true lifesaver for, number one, to keep your numbers up because it gives you access to your patients. So you went from sort of this panic stage to, oh my God, how am I going to see my patients? Now tell us what's happening now that we're, almost a year later, and now you've graduated.
Yes.
And what's happening moving forward? Tell me how the health system and your clinic has pushed the needle forward.
So right now, even, with the numbers starting to go back up, what we do is kind of 2 weeks out, the providers and our front staff, we're looking at the patients who are scheduled to come into the office for appointments, and we kind of screen them and say, okay, who needs to be seen face-to-face? Who can we switch to a virtual visit, whether it's telephone or video, depending on the patient's capabilities? And we have a goal to try and do 50% virtual. We're kind of falling well below that right now, one, because of the patient's capabilities, and two, you can't do certain visits at home when you need vitals, when you need to hit certain markers as far as like the full physical exam when it comes to billing. But so the screening process and going through that as a team, huddling in the morning, who can be switched to virtual, that's kind of the role that we're doing right now in our clinic.
Do you, as you're starting to bring patients into these, what I like to call them virtual house calls, is when who schedules the patients for these? Like who picks and chooses who gets the type of visit? Is it you or is it your front desk?
It's both.
Okay.
And it's sometimes the patient. So with our system, they can schedule an e-visit through their patient portal. They can request a virtual visit. There are times where the patient requests an e-visit, and when we go to read their message, we have to tell them this would actually be more appropriate if it were face-to-face. And that goes both ways. So that's why it takes a team. It takes the front staff to screen the visits, and then it takes the provider to screen our own schedule just to make sure, we're not doing our patients a disservice by, having them come into the office when it could have been handled at home or the other way around.
Do you say to the patients that what would be great is if you had a pulse ox and a thermometer, blood pressure cuff, scale, glucometer? Do you go through that with them to say, and you could be prepared, get this stuff ready?
So that's not a conversation that the provider is having with the patient. And to my knowledge, I don't know if our front staff is saying all of that to them on the phone when it comes to what do you have at home to monitor and to report back. But if I'm in the office, if I'm seeing a new patient and we're establishing care, if I need to follow up with them in a month or even 3 months, then I will have that conversation. Well, this next follow-up doesn't necessarily have to be in the office. We are offering virtual care. And if it's a diabetic patient, they're most likely going to have a glucometer already. Everyone always has a scale, but I always tell them about the blood pressure cuff because it's always covered, or it's mostly covered by insurance under the diagnosis of hypertension. And then with the pulse ox, you can find a cheap one on Amazon. So.
Right. So that's great. So now you're starting. So the key is you're prepping the patients and getting them prepared. And where this virtual house call is moving towards is you're giving the patients more of a responsibility, to do these things rather than having to drag them into the office for a set of vitals, which is what we did often.
And they find that I find that with the virtual visits, they feel like they're playing the doctor role a little bit because they're measuring their own vitals. So, when you send them home, okay, I'll follow up with you in 2 to 4 weeks, and I need you to have these logs. When they come into the office, they leave their logbook at home. They leave all their medications at home. They forget. So, with med reconciliations are more accurate with the virtual visits, and we can review their blood pressure logs, their glucose logs, because they're right there in front of them. And if they're not, they can just go to the other room and grab them.
Right.
And they're excited to do those type of things and actually do the homework because it's a lot.
It's empowering. It's empowering to the patients. That's what we're finding, that patients like these types of visits because it gives them control over their health more. Yeah. And the other part is they seem to be more comfortable in their homes as opposed to coming in, we're wearing our white coat, the blood pressure goes up.
Yes.
Where they're comfortable in their house.
Yeah. They always say they're nervous that I'm going to get on them, or what am I going to say about their blood pressure or their sugar. So they're definitely more comfortable at home.
And do you find that they're getting used to these, right? It's not this fear of technology.
No,
right.
They're starting to request them. There's definitely starting to request them. And if, not every provider leads with, well, this can be a virtual visit, they'll ask, well, can I do a telephone, or can this be a video? And we say, yes, actually it can, or we say, no, we need to see you in person.
Tell us about now you guys are doing a little bit of a pilot project that started that you're a part of with the clinic. So tell us about that.
Yeah. So to my knowledge, again, because I've been a part of the system for 3 months now, so they weren't really doing, I don't think, any telehealth prior to the pandemic. So right now it's a mix. So we'll have a phone call visit or a video visit in between two office patients face to face. So this pilot program we're trying to see if we can do completely virtual. We're starting with just half days. So the first 4 hours of the day or the last 4 hours of the day are just completely geared towards virtual visits. And we're focusing on COVID follow-ups, transitions of care, ER follow-ups, anyone who needs like a medication refill. And it's a small pilot program just to make sure the demand is there and figure out what the technical difficulties are, what's working, what's not working. Why did this patient have to switch from a video visit to a telephone visit? And over the next couple of weeks to months, we'll expand it out to the entire system.
Yeah, so this is a great example of your system trying to, thinking out of the box. And I would say probably thinking that telemedicine is going to be sustainable moving forward, that patients do like bringing healthcare to them rather than them having to go and get in the car to drive to get to their healthcare. I would think, have you asked them, do they like it?
Yeah. We find that it's more beneficial for our patients with small children and our patients with elderly parents, or even our elderly patients who have their children who are very involved in their health care. So they're the ones that have to come to their house, get them in the car, bring them to their appointments, take them to the pharmacy after the visit, and then take them back home. So it takes a lot of pressure off of the family. It takes a lot of pressure off of the parents. We have a small child, so I know how much effort it takes to get the entire family out of the home for a visit. So, it's definitely less time consuming and everyone's just happier.
Right. Great. Well, this is exciting. I think, you're young, you just graduated, and now the pandemic has been awful, but as we say, there's a silver lining in every awful event. And do you think that this is one of the silver linings of, changing healthcare a little bit, being innovative?
Oh, absolutely. And and that just goes to show that I think telemedicine is definitely here to stay. I can't imagine our patients, just wanting to always come into the office, knowing that this is possible. And even when it comes to staffing the office, it allows for less overhead. We don't need as many MAs or nurses hands-on. Providers can do their virtual care from in the comfort of their own home in our home offices here. So, it's definitely something that's going to be here for long term. It was here before the pandemic. It just wasn't at the forefront.
Right.
So,
yeah, we figured we had about 10 more years before we got to this point.
Yeah.
So it's crazy that it accelerated so quickly, but we're glad that it did. And the general finding. So here's a myth that you would think that people your age or younger would be the ones that would be like, go technology, go innovation. And we were very concerned about our elderly patients not wanting to do this. And the reality is that the elderly patients love it.
Right.
Yeah.
And even when they have issues with signing on or figuring out the technology of it, they have children, they have grandchildren who are using this all day. And mostly it's them in the background helping the grandmother or the grandfather figure out how to navigate their virtual visit. So we meet the entire family.
And that's one of the things with the company that we do beyond telehealth is that it takes a village for this to happen. It's not just getting on the phone. As we can see that there's a lot that has to happen to have a successful virtual house call, right?
And what we're getting better with our system is starting this concierge portion of the televisit where whether it's an MA or a nurse, they're calling the patients at least 15 minutes ahead of time to do the virtual rooming, making sure there are no changes to their medications or their surgical history. And then if they have any trouble connecting, they have those 10, 15 minutes to figure out what's going on before we either have to, change around their virtual visit or, reschedule. But the concierge part is also very helpful.
In the beginning of the pandemic, physicians were doing all of this on their own.
Right.
And now they realize that it is the village that, just like they would be face to face, it's a very similar paradigm that happens. So let's leave everybody with, not necessarily a funny story, but just tell us what you have found most heartwarming about being able to do telemedicine with your patients.
So as I mentioned before, it's seeing them in their home environment. It's seeing the entire family, especially because we're getting less of that during the pandemic. So a patient will come in by themselves, or their family member or their ride will be waiting outside in the car in the parking lot because there aren't too many visitors allowed in with them. But especially the children, we miss seeing the children, even if it's for their sick visits. And when they do see us in the office, they're very scared because they think or they know they're going to get an injection. So we don't always get their bubbly personalities. But seeing them at home, playing with their siblings, the infants on tummy time, rolling around, babbling, even if they're napping, the parent, we can see them in their nursery. So it's just very, very warming to actually see them in their home environments, see the family dynamic, since we're missing out on a lot of that in the office these days.
One story that a pediatrician told me from Kaiser was his story was a light bulb moment. I can't remember how old the child was, maybe just months old, and had a nursemaid's elbow. So it was dislocated. And typically that would be bring your kid in, we'll reduce it. But the mom didn't want to bring in the baby, and he guided her on how to reduce the elbow on camera. And he said, once I did that, I realized how much we could do.
Yeah. Wow.
Yeah.
So we're learning new things every day with telemedicine.
Exactly. Well, we'll leave everyone with this. Telemedicine is medicine. Thank you, Brittany. Really appreciate you joining. I love your story. And we'll talk soon.
All right. Thank you.
Okay. Bye-bye.